Hello everyone, this is Professor Muthukumaran, Principal School of Physiotherapy, SBV Chennai, Sri Balaji Vidyapith, deemed to be university. So before we begin, let me ask you something. Have you ever read the research article and wondered, can I really trust these results, or does the study actually apply to my patients? Okay, if yes, and possibly this session is for you. So here I am just going to explore more about how to critique the journal, because critiquing or appraising a journal or any research article is an integral part of any researcher or even a clinicians or even a academicians. Okay, let's see what are the common reasons we the clinicians or researchers are expecting from the research articles. Okay, these are the primary reasons which I have adapted from a research article, of course. And first one is to maybe to impress others and to keep abreast of professional news and to understand the pathophysiology behind any conditions or clinical scenarios, and to find out how a seasoned clinician handles a particular problem. These are the various reasons as you can see on the screen. So these are the common reasons. We just reach out to the articles and then read it to the end. And here is the flow chart to go ahead with the what are the scenarios we just have to look out, and then how to go ahead with the appraising a journal. First and foremost, you just have to look at the title, and you just see to the title whether it is interesting or useful pertaining to your knowledge, or maybe like whatever the what makes you to go to the journal or researching or like search for the article. So what are you pertaining to get the information you want. Okay, if the title of the research article is interesting or seems to be useful, you just go to the next level where you just have to review the authors. Does the author have a good track record of his research articles? Because if you see the research article, the same author would have published a lot of articles pertaining to his research thirst area. Okay, and read the research summary if it is valid, and if you truly believe that the results would be useful, then you consider following the other steps. And if you find, if your answer is no for any of the 4 steps, simply you just have to go and find the new article. Okay, and this is why you just have to what you say, like look for the article and then find the article for the review itself or by appraising it. And first and foremost is the title. So if you are seeing the title which is useful or interesting, and it seems to like giving answer to your search, and you just have to observe. Okay, like look for the title whether it is an observational study, or is a risk association study, or a causation estimation, or it is a evaluating type of study, or it's a interventional trials. So this should be clear enough in the title itself. Okay, and what is the primary mistake what we do is straight away just go and jump to the abstract and then read it. Ideally we should not read the abstract as the first thing as soon as you are compromised or like satisfied with the title as such. What you have to do is you just have to go and read the introduction. In the introduction part, the article should have summarized the current state of knowledge of a particular research area or a niche what they are looking into. And of course, the outline of authors taking on the issue, how the author is going to take on the issue, or maybe a problem which he or she is wanted to solve. Of course, the introduction should end with the clinical question that the paper is trying to answer. So these are the 3 key components has to be there in the introduction of your research article. Then is the identifying a clinical question. A clinical question need to answer the following 4 issues. First one is the population, next one is the indicator variable, third one is the outcome variable, fourth one is the comparison against a known standard, or the it is optional, it should be compared, it may not be compared. Okay, and then identify them as the explicitly stated or complete, stated but incomplete, or fuzzy. So you just have to answer the questions, all the above 4 questions as follows: whether the population is explicitly stated in the article what you are reading, and the indicator variable is clearly stated, or outcome variable is clearly stated, and the comparison against the standard or maybe a quasi experimental study it can be. Whether these 4 questions are explicitly stated in the research article, or stated, or maybe incomplete, or maybe fuzzy. So you just have to consider these parameters in the clinical question of the article what you are appraising. Okay, and here is the research question. So research question as such, okay, for you are going to look for the study. Okay, are you going to look for a new therapy, or maybe as a prevention strategies, or maybe a diagnostic tool, or can to see the prognosis, or maybe see to the etiology. Okay, so depends on the type of your need. If you want to look for the therapy, go for the type of RCT, and if you want to look for any prevention of any problem or disease, something like that, better to go for RCT. Then you just go ahead with cohort type, and maybe if you couldn't find RCT or cohort study, you can go to the case control study. And if your aim is to rule out the diagnosis, okay, how to clinically appraise the condition, okay, in that case you can go for any prospective, even blind control trial comparison to the gold standard. Already established method of fixing the diagnosis is much appropriate. And coming to the prognosis, inception of cohort study is better than the control study, which is, of course, you can, if you couldn't find any of this type of studies, you can at least find the case series. And if your aim is to go for etiology, of course RCT is better than cohort study, which of course is better than the case control study. So the thing is, the type of study what you are going to look, it's going to be depends on the research question what you have. Okay, depends on research question whether it is a therapy, it's a prevention or diagnosis, or etiology or prognosis of a clinical condition. And here is the biases. So of course you cannot have a study without any bias, but you have to find a study which is having a lesser bias. So first bias what you are going to look for in your article appraisal is the systematic error. Okay, systematic error can occur in the designing and drawing a sample. Okay, of course the article what you are appraising should clearly mention what is the design of your study, and then designing of the sample and sampling technique. How did they draw the sample has to be explicitly stated in the particular study. And of course systematic error may occur in the various measurements and the observations of the study, even the outcome measures. Okay, outcome measure can be appropriate, but the way of measuring the outcome plays the major role in avoiding the biases. And it is the designing and making comparison between the groups. Adapting a poor research methodology or maybe a clinical study type makes a big error in the results itself. So these are the things you have to interpret in your journal or article appraising. And second one, you just have to look for a sampling biases. Sampling biases, of course we have like two types, probability and then non-probability sampling. And in case of non-probability sampling, there should be a consecutive sampling has least bias over the convenient and judgmental sampling. Make sure whichever the article is having a better sampling types pertaining to their level of study is more important. And make sure all the sampling has to go through 4 steps. It has to have a target population, accessible population, and of course intended population including the dropouts and also the study population. Okay. And in case if the inclusion exclusion criteria is too loose or too tight, okay, if the inclusion criteria is broader or if it is too narrow, the chances of fetching to the appropriate samples is high. So look for the inclusion and then exclusion criteria which is having a right weightage, or maybe like it's appropriate to the objective and then type of study they are intended to do. And of course it's inevitable to have the dropouts. Of course all the participants, as general rule, more than 50% is automatically invalid. Okay, if any study mentions their dropout is more than 15%, of course practically you cannot rely on the results. And make sure if have they mentioned the prior sampling calculation, how did they derive to the sample size, have the study mentioned the sampling calculation processes, that also you just have to consider. And next you have to look for the measurement biases. Here the measurement biases, though you can adapt a better outcome measures, but biases might happen during the process of executing those outcome measures. Okay, whereas the problem might end up in the precision and then accuracy of the outcome measures, or measurement biases could happen. And it can happen from 2 sources. One is the observational making measurement and the device used to measure. Okay, observer. So if you are allocating, a researcher can allocate even a third person, maybe the outcome measure can be measured by other individual who is other than the primary researcher, maybe a principal investigator. In that case measurement bias can happen because of the individual who is administrating those outcome measures, okay. And whereas the device used to measure, that can happen because of the devices, maybe due to the poor calibration or something like that, which is a inevitable part of any measurement. So measurement biases could happen. That can be minimized by adapting a better outcome measures, or maybe a trained individual to measure the outcome measures, or adapting a gold standard calibrated equipments or devices or certified equipments for that sake, to avoid the measurement biases. Make sure the article what you are looking for fulfill these criteria to avoid the measurement biases. And other than that, biases can happen in comparison and comparing, okay. Where the biases usually might happen, that there is a saying in research where you can compare the apples, not the oranges, okay. No way you can compare between the apple and the oranges, because they are two different entities. Lot of the times we end up in finding the articles or the researchers where they are comparing the two distinct groups, which has nothing to do with the core objective of the study. So that has to be avoided, okay. And find the article which is having a control group, because without having a control group any study, you cannot claim that the changes, or maybe even if it is significant, it happens due to the intervention, not due to or by chance, okay. So we may not conclude it, the changes does happen or did happen because of the intervention or not. So control group is must to have, and poorly matched controls also become an issue when it comes to the interpreting the results of a particular study. Here is the p-value. So finally you will be ending the before going to the results and then interpretation. Two things you just have to primarily consider. One is the p-value and the other one is the confidence interval, okay. And you all know what is mean by p-value. P-value is the tells you that whether the result is real or is just due to the chance, you know. If the p-value is lesser, so you can say that the changes happen due to the random factor or by chance is very less. So in that case, p-value plays the major role. So actually what does it mean by p-value, okay. Actually it doesn't measure the size or importance of an effect, okay. And of course it doesn't tell you how likely the hypothesis is true, and it can be significant even for trivial differences in larger samples. So p-value alone is not enough to conclude the intervention is effective. What the other factor you have to consider is the confidence interval, which I am going to talk in the next slide, and check if the p-value is reported for main outcomes. Ask, is the difference statistically significant, and then you have to ask yourself, is it clinically significant or relevant. So both the thing have to consider when you are interpreting the p-value of any given research article. And next important thing you have to interpret or consider reviewing along with the p-value is the confidence interval. Confidence interval tells you how large and precise is the effect, okay. In your journal appraisal, when you appraise, always check if CI, which means the confidence interval, are reported for main outcomes, okay, the primary outcome, okay. What are the primary outcome you are looking for has to be explicitly mentioned about the confidence interval, of course with the p-values, okay. So and does the CI cross the line of no effect? For mean difference, does the CI include 0? For odds ratio or relevant risk, relative risk, does the CI include 1? So both the things you just have to consider. And the width of CI, which means the width of the confidence interval, shows the study precision. So wider the CI, small sample or high variability. So you should have a lesser p-value and then narrower confidence interval for the better reliable results. And this is what I am just talking about. So interpreting both together. So no point in considering p-value and then confidence interval alone. You just have to interpret all together. Find a study if a particular study you are reviewing have a smaller p-value and narrower confidence interval, it's quite reliable and then likely to be a real effect of the intervention. And if your study or appraising or reviewing is having a smaller p-value but have a wider confidence interval, there is a uncertainty in the magnitude of the effect what they have got through their study. If the p-value is large and the confidence interval is wide, and probably the effect or the significant effect whatever is not going to be the useful when you are reviewing a study. You cannot completely rely on the result of the study. As such, it cannot be simply translated into your practice. Finally, the results. So, the results has to answer the 4 clinical questions. It can be a therapy, it can be a prognosis or a diagnosis, and economic decision or analysis. And you just have to review the results on your perception. Perception is on your need, whether you are reviewing the article to know the advancement of any upcoming therapy or effectiveness of any therapy you are trying to implement or try it on your patients, or to look for the prognosis of the condition or maybe a disease or whatever, and maybe a diagnostic tools. Even it can be a simple clinical test or stress test or any assessment tools. So you just have to find the effectiveness of those. Or there are articles which talks about the economic and then decision analysis, how much it has the economic burden on the patient, including like correlating with the risk and maybe the interventional cost effectiveness. So inclusively you just have to consider this as well. And finally, here is closing the loop. Closing the loop in the sense there is a mnemonic like infer. You just look into the article whether it is interesting, okay, and the article should be novel, whether is it saying something new, and it should be feasible in your context. Though it is new, though it is novel, it's quite interesting. If it is not feasible in your context, and there is no translation of research to the practice. And make sure whether the article is address more ethical and then having the cultural constraints, because a lot of articles, though it can be translated in some Western population, maybe in Indian context we cannot translate those findings into our clinical practices. Okay, and finally end up with the resources. What are the resources you have in your clinical setup? And that's all from my side. See you all in the next session. Thank you.